Well, good afternoon. Today, more regions of Ontario are reopening. And with that, more parents are heading back to work. So I know the return to school is top of mind for families across the province. And I know it hasn't been easy for students being away from school, not seeing your friends, and missing out on extracurricular activities. But I want to thank all our students, teachers, and parents for doing their part to contain this virus these past few months. I know kids are eager to get back into the classroom, and parents are looking for guidance for the plans this fall. But it must be done safely, and it must be done under the right conditions. Over the past few weeks, we've started to reopen Ontario's economy. We took a regional approach that matched the reality on the ground in the different areas across the province. And as regions of the province move at different speeds to reopen, the same should apply for their local school boards. We simply can't provide a blanket solution for the whole province. Instead, we need to provide school boards the tools and the guidelines to get the kids back in the classroom. We need to empower the school boards to make decisions based on their local needs, their local challenges, and their local priorities. Over the past few weeks, we've worked with our Chief Medical Officer of Health, our command table, and the experts at Sick Kids to develop guidelines for school boards to help them prepare to reopen schools in the fall. And today, we're all rolling out our plans to work with school boards across the province to get kids back to school safely, based on the best medical advice available. We'll be working with each school board throughout the summer to create a plan that fits best for their communities. The options will include regular in-class learning with public health protocols in place, at-home learning, or a mix of both, with in-class sessions capped at 15 students and students attending on alternate days or weeks. Minister Lecce will get into the details in a moment, but I want to make a few things clear. The fact is, this virus remains a threat, and the health and safety of our children will always remain top of mind. But I can assure you, Minister Lecce and his team are working hard to get you and your family the answers you need. Answers on safety, answers on routine, and answers on your child's education. Our plan ensures that whether you live in St. Thomas or Mississauga, Ottawa or Kenora, rural or urban Ontario, school boards have the flexibility to choose what works for their schools, students, and teachers. We're taking a very cautious approach here, but as a parent myself, I know how you feel. Many are worried about this new environment, and you need certainty as we move forward in our plan to reopen the economy. So I want parents to know that you also have a choice. If you don't feel comfortable, if you're worried about your child returning to school, we'll keep at-home learning available for your child. The health and safety of every child remains my top priority, bar none, over anything. And as we get closer to September, we will continue to keep parents informed. And we'll make sure your child can keep learning in the safest way possible, because nothing is more important than a child's education. Thank you, and God bless the people of Ontario. I'll turn it over to Minister Lecce now.
Well, good afternoon, and thank you. First off, if I may, I just want to offer my deepest condolences on behalf of the ministry to the educator and the children that passed away so tragically last afternoon. As the Premier made clear, we made a commitment to parents to unveil a plan before the end of June to keep students safe and to keep them engaged in learning. To unveil a plan that enshrines safety as our guiding principle. Notre gouvernement mettra toujours la sécurité au premier plan. Today we are unveiling a plan for the safe reopening of schools for September. A safety plan developed in consultation with the best medical minds, the Chief Medical Officer, the COVID-19 command table, the Hospital for Sick Children, educators, parents, and students, and of course you, the public. And let me lay out our vision. Our plan to get kids safely back to school. First, we will be ready for every scenario. We are tasking school boards in Ontario to produce 3 plans to prepare for any circumstance that gets thrown at us as a province. Number one, a plan for the return to regular in-class instruction with strict health and safety protocols. The second plan is a plan for the continuation of remote learning by strengthening the use of live, online, synchronous learning and instruction and creating greater standardization of that approach. And finally, a plan, an adapted delivery model that blends the in-class instruction with online learning. It would include alternate days or weeks and staggered bells so that class sizes do not exceed no more than 15 students within them. This cohorted approach asks that students remain in contact only with their classmates and, to the extent possible, a single teacher throughout the day. This reduces risks, it enhances contact tracing, and it allows kids to be kids, to play together, to eat together, to study together, to give each other a high five. It's important to the social and emotional learning and development of these kids and their mental health that they're able to do that. Now, for September, while boards will have plans in place for all three scenarios, I expect that all Ontario students will enter into a cautious adaptive delivery model. What that means is classroom sizes of no more than 15 students for September, every other day or week in class instruction, supported by a strengthened online learning experience. We are being cautious, but as the Premier has said, we will not put your child or our staff at risk. We will start using this model, and after September, we will evaluate the effectiveness, the safety, and operational impacts. Should Ontario continue to flatten the curve and make gains on a regional basis, we will allow school boards to move closer to that conventional delivery. That is important. Meaning if the data moves in the right direction, then we will slowly but prudently move towards conventional class experience, but always with those strict health and safety protocols in place. That decision must be approved by the local health officer. We will establish a table of leading doctors and scientific experts to review the plans presented by the boards to ensure that evidence, science, and medical expertise guides those decisions. Folks, we know kids need to be in class. We've heard this loud and clear from the Hospital for Sick Children and other medical leaders. The mental health impacts are real on our kids. So we hope, and we're planning for students to return over time in short order to a full-time in-class experience with health and safety protocols in place. We know the value of human connection and community for our earliest and youngest learners. Many students haven't seen their classmates since March. We know our schools do much more than just educate our young minds for the future. They foster a sense of community. Now, as the Premier said, we've led extensive consultation with so many, with parents and students and educators and staff on the way forward. And what we have heard loud and clear from parents is that you want to be in the driver's seat and ultimately have a choice. They want and will have an option to enroll their child in class or in a strengthened online learning experience. Parents should make that decision, and we will respect your choice. Now, with respect to funding, to prepare and ensure a successful restart, every school board in Ontario will receive funding increases. Per pupil funding is up. We're investing in the Grant for Student Needs an additional $730 million to ensure our restart is safe for kids. We've increased mental health funding for September by an additional $10 million, which is going to help hire more psychologists, psychotherapists, and social workers. We've increased funding for technology, an additional $15 million to purchase upwards of 37,000 devices and Chromebooks for kids in the province. These are the two highest investments ever recorded for mental health and for technology, with health and safety as well being top in mind for the government. Top of mind, we're also providing $4 million to school boards to assist with enhanced cleaning, procuring of hand sanitizer and soap. Because at the end of the day, we'll do whatever it takes to keep kids safe. We're also increasing investment for special education and asking boards to ensure students with significant special needs are in class for the entire week. To support those parents who have asked us for a plan that creates stability and consistency for your child. Now, these plans will be developed in partnership by boards, working with their local unions, with communities and parents to develop these plans and implement them. You know, the next 75 days will be critical. So I'm asking all the parties to embrace that spirit of partnership as we work to develop and implement the safe reopening of schools. Finally, I just want to end by thanking our educators, our parents, and our amazing students. You've truly inspired our province through this difficulty. And to our grads, we salute you for getting through this. This is a a year for the history books, but we are incredibly proud of your contribution. So thank you to parents, students, educators for your hard work, and thank you for the opportunity, Premier.
Thank you, Minister. Before I start, a message to the Chasula family and the loss of a beautiful, beautiful family, 3 kids, a mother. It's absolutely heart-wrenching. Our prayers, our thoughts are with you and your entire family. And justice will be served. Our prayers are with you. We'll start off with the questions.
Okay, we'll go to the phone line. First question.
First question comes from Caroline Alfonso from the Globe and Mail. Please go ahead.
Hello, Premier.
Hi, Caroline.
My question is for the Education Minister. Minister, with the scenarios, will there be any sort of set rules, or will we be seeing a patchwork depending on local public health decisions?
We are setting out, Caroline, a clear and detailed health guidance for all school boards, which they must meet. And these are high standard of care. We want to make sure that we take no risk when it comes to the opening of schools. What we are allowing is largely after September, if in various wards and regions of the province where the risk is low and the curve continues to be flattened, then what we're allowing is to return from a adaptive model to a more conventional model. And that will make sense. I mean, in the abstract, we don't want a one-size-fits-all. You can't in the size of our province. We need to make sure that there is an element of variance to allow boards with low risk to move to the next phase. And likewise, if there is a risk to the province and a second wave, it allows us, of course, to scale back as well. So that is the guiding principle. We provide clear health instruction to all boards, which they must meet, from cleaning protocols to enhancing the cleaning and wiping of all high contact surfaces. There's specific protocols laid out for deep cleaning as well as for buses. I mean, in each area there will be guidance, and we will expect adherence to them, but we will allow them to move up to the next phase to more conventional learning based on the success within the regions when it comes to public health data.
Follow-up.
And my follow-up question is, the Hospital for Sick Children released its recommendations this week, and among them were no physical distancing among children needed outside. Will you follow that guidance?
Well, the protocol we've unveiled does require for students to be cohorted in groups of no more than 15 for September. What that allows students to do, as I sort of described as a new normal, is to be kids. It allows them to play together, allows them to eat together, to study together. And that by doing so, we allow these children to have more interaction and more humanity when it comes to the educational experience, more of a personalized experience, if you will. That's important. That includes for physical education or for in-class instruction. But the bottom line is, by maintaining a cohorting approach, by an adaptive cohorting approach, we allow children to be kids. Of course, they're limited to that group of 15. They're going to be limited to the extent possible, one educator, because we want to limit the contact outside of that. But this approach permits children to do that and to have contact while still respecting the most obvious cleaning guidelines as well as personal hygiene guidelines, which will be set for September.
Next question.
Next question comes from Chris Rushowy from the Toronto Star. Please go ahead.
Thank you. My question is about school-based daycares. How are they going to operate if schools are shut down or if kids are attending part-time or rotating to the schools?
Thank you, Chris. Yes, with the reopening of daycare, daycares and schools can reopen under our plan. They can in the immediate term now, and that the emergency order has been lifted, and that could certainly be the case in September. Local boards will be working with the tenant, with the operator, on how that will be implemented. But the short answer is yes. Childcare operators within schools, likewise outside of schools, are able to open, and will do so with the strict health and safety protocols the government has unveiled.
Follow-up.
Okay, thank you. My next question is for the Premier,
Yes.
and it's regarding the retail holidays. I was just wondering if the government was going to be making any changes to the number of stat holidays for retail workers. Just wondering if you can clarify that, if the government looked at that as a possibility.
No, we aren't doing that. I think people should spend time with their families. I think there's 9 stat holidays. As much as, you know, the malls would be packed, everything. I just think people need to take a break 9 times a year, and so it's not happening.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Haley.
Hello, thank you. My question is for the Education Minister. Minister, this hybrid model, what about parents who have full-time jobs and are called back to the workplace by the time the new school year begins? It seems that may be very difficult for them if they don't have childcare options.
No, I very much appreciate this. I mean, the guiding principle for our plan is health and safety. It's the basis why we closed schools, the first in Canada to do so, recognizing, I think for the entire cabinet, the impact personally, financially, economically to an individual and the impact that they have on the labor market and on their job. But we don't make these decisions lightly. But when we're talking about a child, your children, our obligation is to make sure that we follow the strictest health and safety protocols that we can create in this country. And the Chief Medical Officer of Health, Sick Kids Hospital, some of the leading institutions, pediatric institutions in the world, have suggested that this framework will work and it'll keep them safe. And that's our commitment. To be fair, what our intention is to return to day-to-day conventional educational experience. I mean, you know, we all would love for that. But out of an abundance of caution, given that we're talking about going from 6 months of closed schools to 2 million kids in school in September, we've got to get this right. My instruction from the Premier is, you know, to do whatever it takes to ensure a positive, successful, and safe reopening. This plan does that. Obviously, the childcare is reopening as well as home care continues to be an option. Day camps are opening in the summer and thereafter. And we know that there will be many partners who, you know, may wish to step up to offer additional ancillary day camps for those parents impacted. And I want to be very transparent to parents. We recognize the consequence that will have on you, but we do not ever want to, you know, see a scenario where a school has more students in it, or more kids within a school class that can create risk to themselves and to your family. That's just not something we're prepared to do. And so we're going to get it right in September. And with the good work of the people of Ontario listening to the medical advice, we will return to conventional learning in short order and give that sense of certainty to parents and to the marketplace.
Thank you. And my follow-up is also for the Education Minister. For school boards that decide to go with full in-class learning or even this hybrid model, what are the protocols that are being recommended if a student tests positive for COVID-19 or even someone in their family tests positive or that one teacher or someone in that teacher's family tests positive? Would the entire class be told to self-isolate and stay home?
Yeah, the Chief Medical Officer has provided guidance on the protocol. Obviously, screening is going to be a foundation of how we ensure that students, when they enter, are entering school safely. And we are asking for a partnership, as we always have, with parents to, you know, share transparently any symptoms that they have that child should not be in school. There are isolation protocols in place should a child have symptoms in the class, where there'll be spaces set aside within school. They will be isolated and safe and monitored. But obviously, the requirement will be for parents to, as they would in any other year, to pick up their child should they be sick. We don't want to create exposure for other children. That's why we really need that social contract with everyone involved to do their part to monitor before. But screening will be a requirement. There will be limitations on only essential people can enter a school, staff and the child, and obviously parents with certain circumstance for using the office. But the reality is we need to ensure screening is done right at the beginning. And that's why we have a clear protocol put in place, as well as a protocol for isolation. And for students that are COVID positive, or for anyone that is COVID positive, the benefit, if you will, of the cohorting model is it allows that risk to be limited for those kids to be tested, and ultimately for a more responsible and more sort of granular approach to working with that particular group of class versus doing an entire school or a larger community where that impact could be very destabilizing for a lot of people.
Next question.
Next question comes from Travis Denrash from Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. Hi there, Minister. So a lot of parents and educators are already chiming in on social media saying that this is essentially a non-announcement, that this is kicking the can down the road further, and that they have no clarity in terms of what is going to happen with their kids in September. So what do you tell parents that thought? Because the minister said that he was going to provide a plan. That plan was coming, and now they're finding out actually a plan isn't coming until August sometime, perhaps?
I'll pass this over to the minister.
Yeah, sure. Thank you for the question, Travis. Let me just reaffirm what we have announced today. We've announced that parents will have a choice for online or in-class delivery. We've announced that the province is investing an additional $730 million in net investments to ensure that the restart in September is positive. More money for mental health, more money announced today for technology, for cleaning. We've set out clear health protocols, part of today's announcement, to guide school boards and give expectations to parents transparently on what those cleaning protocols will be and what the general protocol for the return to school will be. We've announced today that schools will open in September. We've announced, in addition, that there will be a maximum of 15 kids within that school, within that class, for the month of September using a cohorting model, an adaptive model of online and in person. As you know, we have 72 school boards. And what we've asked of them is to spend the next coming weeks to build a plan for every scenario. Because as you can appreciate, there's so much variance. This is happening and changing so quickly. We need to be prepared. And what we've learned the last few months is that governments of all stripe, we need to be ready for the circumstances on the landscape. I don't want to see a child having their education upended because the world is having to make this pivot and have to make this adjustment. We will be ready in September. And so we're permitting boards, we're giving boards the ability to license, to build those plans based on the local reality, based on consultation from the local unions, based on the local health reality of their community, because Ontario is a large place and the risk is not linear. It is more concentrated, as you have seen, according to public health. And so we have unveiled that plan. We're going to continue to allow boards to work with medical and scientific leaders in Canada, have access to those people to review their plans. I think that is an important start as we signal to parents our default and commitment on safety, coming up with clear protocols, and more importantly, demonstrating a willingness to get this right with a cautious restart for September.
Follow up.
So is there a bar that you have received from the health table in terms of the daily infection count? Does it need to be under 200? Is there a specific number in order for kids to go back to class fully for a normal school year to resume in September? Do you have that number?
The decision point, as I noted, to move up from the adapted sort of every other day, every other week model capped at 15 kids in the class with social distancing, with cohorting, that's a decision point that won't be driven by me, as minister. It'll be driven by the local health officers, by doctors within the communities and boards across Ontario to guide that decision. And to be fair, I think what I've heard from my consultations from parents is they want this to be evidence-based. They want our decision to be informed by the best scientific and medical minds. That's been the default of the government since day one in this dealing with the outbreak of COVID-19. And that will continue to be the case in the Ministry of Education to make sure that parents know that every decision we make to scale up from adaptive to conventional learning will be made on the advice of the local health officers within communities across Ontario.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. The other day you were asked about allowing bars and restaurants to continue their delivery and takeout options for alcohol after the pandemic was over, and your answer was kind of vague. So I'd like to ask you clearly, do you support that continuing past what I believe the deadline right now is January 1st, 2021? Do you support that continuing after that and after the pandemic's over? And if so, does that mean you're walking away from your campaign promise of beer and wine in corner stores?
Well, I'll start off with the beer and wine. I'm not walking away from it at all, but I have higher priorities than beer and wine in the corner stores right now. So that's going to continue to move forward. And I can't give you a yes or a no on the other question that you had about letting restaurants and other areas, deliver liquor to homes and that, but I don't think it's a bad idea. That's my opinion. I want to sit down with our cabinet and give you a straight answer. But right now, everything's on the table.
The other thing that you changed in allowing for delivery was cannabis retailers to offer delivery, and that will eventually either be shelved or renewed as well. Prior to the pandemic, they weren't allowed to deliver. But many in the industry are hoping it will continue. Meanwhile, the Ontario Cannabis Store is actively campaigning to keep a monopoly on that. I'm sitting here looking at 48 different, so 4 dozen illegal weed delivery services, as they call themselves, that will deliver to your constituency office in Etobicoke. If you really want to deal with the black market, should you be allowing the local legal retailers to continue this and try and stamp out these illegal ones that are operating very openly and publicly?
I don't believe in anything being illegal. So yes, we need to put an end to it, and we need the cooperation of the local stores. But I understand where OCS is coming from, and I understand their concerns, local stores. So that's under discussion with the Attorney General's office, along with the Minister of Finance, and we'll come up with an answer once that comes forward.
Last question.
Last question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Alison.
Hi, my questions are for Minister Lecce.
Yep.
Minister, with all of the extra cleaning protocols that will be in place, will this increase in funding for school boards be enough to hire extra custodians needed for all of this cleaning?
When the government confirmed and concluded negotiations with our union partners, when we got all the deals ratified within it, we decided to proceed with a new fund, the Support for Students Fund, $200 million put aside, but redesigned to reflect the priorities of parents and students: STEM education, mental health, spec ed. Within that $200 million fund, $100 million is set aside for education workers. This means that nearly 2,000 custodians can be hired in the province of Ontario for this September, should local boards believe that that is a priority. It won't be linear. Some boards will have that capacity, some will need more. We've put agreements to allow boards within the about $100 million of that $200 million for that purpose, to ensure schools are clean and safe. The custodians are going to do important work, and we are honestly very grateful for what they've done to date within our health infrastructure, within the schools, and the people who have redeployed. 400 individuals have redeployed from education within our long-term care, congregate care centers and hospitals. It's amazing. It's a wonderful demonstration of the spirit of our province. But the point is, there is money set aside for hiring. In addition, there's $4 million set aside for procurement for soap and Purell and sanitation supplies, so that in September there's a strong start, sufficient visibility of those items. And because of the cohorting model, allowing school classrooms that may not have a sink to use the cohort model, get to a sink, wash their hands frequently through the day, return to the class in a safe, grouped manner.
Thank you. And on teachers, with this blended model of in-class and online learning, is our system going to have enough teachers to pull this off, especially given that we saw some teacher jobs or teacher positions lost in the school year?
Well, teachers will obviously be playing an important role in the context of implementing this plan. And we believe and we know that they'll rise to the challenge, do their very best in this difficult circumstance. And so we express gratitude to them. But the bottom line is, when it comes to September, what we're requiring is for educators in the province to provide in-class instruction and to be prepared supported by professional development, which we're going to be making available and mandatory for all educators in the province of Ontario to have more development in the area of online learning. Because the truth is, not every educator in Ontario has been using virtual learning before. And to be fair, they weren't required to. Some did on their own volition. We now want to make sure, given the experience of what the world has faced with COVID, we're ready, and that the educators have the skill sets, the competencies that they need to work in this environment, especially if, God forbid, we have to revert to the third option, which is a remote distant learning option, again, as we have done for the past months. So we're providing professional development. We've invested money to ensure virtual learning environments, which is the platform that allows for online learning to be in every school in Ontario. It's this government that is connecting every high school in the province of Ontario to internet for this September. And obviously there's more to do in this respect, but we are ensuring that our infrastructure, our internet, we just announced yesterday 15 million net new dollars to buy 37,000 computers to help get more access to technology to more people and to more vulnerable families. I think that shows that we are going to make those investments where it matters, and we're going to take safety very seriously through this process.
Okay.
Any other questions?
Jamie was going to ask one last one from Jamie here.
Yes.
So, further into last night's accident, we know that a large percentage of drunk drivers are habitual drunk drivers that have stopped and you want to drive directly to last night's accident. But when you're a drunk driver, chances are you're going to be stopped over and over and over again. Is there something, should the province be looking at stiffer penalties, even jail time immediately for people that are habitual drunk drivers? Also, there's the other thing. Police don't involve themselves in pursuits anymore because of the consequences of a guy speeding and creating a wreck. We've seen that many times before. A person that takes off from a police officer, should we look at fines and bigger penalties for those people? There are YouTube videos out there where motorcyclists actually taunt police and then take off, knowing that they're not going to be caught and or prosecuted.
Well, Jamie, good question, and I haven't stopped thinking that Chasulo family since I've heard about it. It's been on my mind, non-stop. It's heart-wrenching, but we have to toughen up the penalties. It's not us either. I'd throw the key away. I'd keep these guys in jail for the rest of their lives. We have to get tougher sentences from the feds. You know, we need judges to go up there and put the hammer down and throw their key away. These lenient sentences are unacceptable, in my opinion. This is a family that's just been destroyed. I can't even imagine what the husband and the father is thinking right now. It's heartbreaking. Every person listening can relate when you have children. Sorry. It's very, very difficult. So if it was up to me, I'd throw the key away to all these people. Justice has to be served. And none of this 1, 2, 3 years after taking a family, just wiping out an entire family, young children, and what they get out in a few years, unacceptable. I'd throw the key away 100% with these people.
Okay, thank you.
Thank you, everyone.